I'm Philip Ward, Editor-in-Chief of ArtMiniEurope.com. One of last year's most dramatic sessions at ECR was about gadolinium safety. Is it safe to use contrast agents, specifically in the brain? I'm very pleased to have Professor Heverhagen from Bern in Switzerland with me. He was at that meeting. He made some very key points during the session. Professor Hagen, thank you very much for joining us.
Thank you for inviting me.
Now, what has changed in the last year since that special focus session that we both attended? What's new?
Unfortunately, not much is new. There's still a hype going on about possible dangers of gadolinium deposition, even though there's no clinical symptoms found yet. A couple of animal studies came out that showed that all the contrast agents deposit gadolinium in different rates, but every agent deposits. But original research in patients did not really come out.
Okay. Now, during the session, several speakers warned of a gadolinium fever, that this was a real danger. Do you think it has happened? Is it still present, that phobia?
It sounds like. Luckily, in Switzerland, I don't have the impression that it's come to a phobia, but what I hear from colleagues, especially from Germany, a lot of patients are concerned and don't want to get any gadolinium, even though they probably need it. And it would be probably dangerous to not do the study with gadolinium, because the health effects are much more concerning if you don't get the MRI.
Right. Now, you also said during that session that a lot of these studies are small, retrospective, and single center. Is that still the case?
That is still the case. As far as I know, there are no new studies that are multi-centered or have a larger population, which is also, it's hard to do, because who wants to be part in such a study? I mean, ideally you would take people who have never gotten contrast agent and investigate them over time. That's very hard to do today. So.
Okay. Now, the European Medicines Agency are looking into this issue. They're investigating at the moment. Is that report imminent, do you think, the findings of that report?
I'm not sure. The deadline has moved 2 times already. I assume it's coming out after ECR now in the next couple of weeks. But I'm not sure. There's not much leaking out from the EMA.
Okay. And you also said during the session that there is a real risk that every product leaves gadolinium in the brain, and that the agents may be withdrawn en masse from the market for that reason alone. Do you think there is still a risk of that?
I think it's not very likely, but I think that there is still a risk, because if you think that gadolinium deposition in the brain or anywhere else in the body is bad, then why would you withdraw one agent and not the other one if every agent deposits gadolinium? So there might be a real risk, and especially for somebody sitting in an office in Brussels, probably just hearing that and getting the information there's deposition, he might just say, let's get rid of all of them.
Okay. So in the meantime, what advice would you have for radiologists, our readers, our viewers, our members, and what would you say to them in terms of measures that they could do?
I think the most important advice is to not withhold an MRI with contrast agent from a patient that needs it. You should then limit the gadolinium dose, obviously, use the lowest dose possible, and you should also probably not use the high-risk agents, even though it has not been shown that there's any danger from the deposition, but the high-risk agents deposit more than the rest of the agents.
Okay. In your own department in Bern, in Switzerland, have you changed your own practice?
Not really. We do what I just said. We do not withhold MRIs from patients that need it. We try to limit the dose to the lowest dose possible. And we only use agents from the low or medium risk group.
Excellent. Well, we eagerly await the EMA report on the issue of safety. We look forward to the session on Friday afternoon, 4 o'clock, on this topic. It's called the Yin or Yang story, and we urge you to go along and perhaps cover that online if you missed the session. Thank you very much for your time today. And we look forward to further discussions.
Thank you.
It's Philip Ward for ArtMini Europe signing off.